dear all, Mr. D, Mr. Chairman, co-chairman, dear my colleague and our students, thank you for dating this lecture, and we are happy to be with you. How the infectious system run away in Iraq, and what's the way? I has no any conflict of interest regarding introducing this lecture. What's the status of infectious disease in Iraq and how the system started? We has many conflicting problems in Iraq. These some problems it's difficult to solve, and some of them are hidden, and some of cases appear and then it gone. At many our patients die without we know what is going on. So all of you facing in your daily work this problem. There is many infectious conditions which is not solved, and we didn't find any solving of the condition. So an example of it, many viral outbreak in cyclic manner appear. Like in this season, we has a viral infection outbreak without we know what is it. And then we just give symptomatic treatment, and sometimes we give antiviral in assumption it is a viral infection, depending in complete blood count. When we study, there is normal white BC and there is lymphocytosis. So we expect it is viral infection, and then we give trial of antiviral if it is symptomatic treatment improved. And all of you face this condition, and this occur cyclically. In winter, we has a viral outbreak. In autumn, viral outbreak. In summer, viral outbreak. And this problem is common in our society, and it is a fact in our clinical work. Then we progressed because many factors. We faced many resistant cases like pneumonia. It appear pan-antibiotic resistant Klebsiella pneumonia, which is strange and it is uncommon. And the patient died, and we have many cases of our patient died from pan-resistant antibiotic Klebsiella pneumonia. And we have many resistant bacterial infection which appear due to multifactorial, one of them misuse of antibiotics. Then the condition, when we brought more, we found many parasitic, abnormal parasitic infection, like Hydatid cyst of the heart, pneumocysticercosis of the brain, multiple Hydatid cyst of the brain. It is not easy. It is difficult to reach this position. So not easy to take biopsy from the heart. Not easy to take biopsy from the brain. Not easy to take a biopsy from cyst from spinal cord. So these are abnormal presentation of parasitic diseases made it is conflicting subject in our society, our community. Abnormal presentation of tuberculosis, like multiple granuloma in the brain, presented as tonic-clonic fit, and then appear it is TB brain. TB brain. Or we have enteritis, focal mass, then appear it is TB. So we have many abnormal presentation. I just give one or two samples of our condition, about condition whom we face all together in daily work in our practice. Then there is emergency of abnormal fungal presentation, like a pleural effusion. When we put chest tube to patient, a black fluid came from pleural fluid. When we study it, it appear fungal infection, fungal pleural effusion. then we return retrograde for the condition, it appear hidden sarcoma of the patient. So these conflicting conditions in our community and in our daily work made us in that to work together forward to build a system who can solve this problem. Although it is difficult at the beginning, but then it will be easier and easier in the future. From this condition, there is a hard need to make guidelines which related to the national and local areas guideline, which is related to our country and nearby country, because sometimes with nearby countries we share same diseases. So we need guideline to manage these conflicting cases and to do a roadmap, a plan in the future, how to solve these problems. We need many teams. These teams is multidisciplinary team. That multidisciplinary team to solve a problem. And you all remember era of COVID. And then we face a bigger problem when I face myself. I should fight against Crimean Congo hemorrhagic fever, especially in the Iraq, and we made many connection, many lecture, many communication, how to solve this problem of Crimean Congo hemorrhagic fever. And then I find myself in managing Crimean Congo hemorrhagic fever. And then we asked from WHO to put guideline. When we do the guideline, we need a vet doctor. How to prevent tick from transmitting infection of a Crimean Congo hemorrhagic fever to the human. We need public health to prevent the disease. We need vaccinologists to make a vaccine to human. Then we need pharmacologists to use antiviral treatment, especially when we use ribavirin. After many connection, many conferences, many communication, we decide to use ribavirin as it used in Tajikistan and in Iran and Turkey. And then after ribavirin use, mortality rate from CCHF, Crimean Congo hemorrhagic fever, reduced from 40% to 8% in Iraq, lastly, which is the biggest result in the world. That mortality rate all over the world, 40% for CCHF, in Iraq became 8%, as our my dearest friend, Professor Mudar, he know. Then should be made a roadmap line management for HIV and AIDS condition, tuberculosis, CDC especially. It is managed not by physician in Iraq, and that made a hole between us and them. When we discuss guideline of a Crimean Congo hemorrhagic fever in Ministry of Health with CDC manager, we find a different thinking between them and us, because they don't understand the thinking of physician. And we made a many connection, so we reduce this. So that means that these systems should be physician enter in that system, and it was not easy to enter a physician in that side. So we made any connection, and we decide to do infectious board, Iraqi and Arab infectious board. Arab board of infectious disease opened in Basra by Professor Ali Rahim, and Iraqi board infectious disease in Baghdad, whom we built up. And then I became decider of the study, and the head became Professor Nazar, which is the head of internal medicine specialties in Iraq. Then we decided to make all we connected to made Iraqi Society of Infectious Disease, and then we made as one hand We are four from this college, me, who made the Professor Yasin, Assistant Professor Hazim, and Assistant Professor Sami Mikhlif, and then with Professor Ali Rahim, Professor Dr. Azhar, specialist from the Iqar, which is a hero whom treated, one of the hero of medicine whom treated Crimean Congo hemorrhagic fever in the Iqar, which is the main site of Crimean Congo hemorrhagic fever. And then long list of our professors who made this society. And then we decide in this society to do it multidisciplinary, and this multidisciplinary team who can support the board, Iraqi and Arab board, and can from them made guideline, because in the society, as Dr. Hazim, Dr. Yasin, Dr. Sami know, we has Dr. Mustafa, which is a professor in pharmacology, Dr. Faris Lami, which is a professor in public health, and he's a head of Subtain University. And then we succeed lastly to make Iraqi Infectious Disease Society, and just we are waiting the administrative order for burning of this new society, whom will support this system strongly in Iraq. Thank you, Chairman. Thank you, Co-Chairman.